Hello students, welcome to We Learn Virtual Learning Network. We are going to study Introduction to HRM in Hospitals. This is session number 5. We will be studying part 1 of Reducing Patient Mortality in Hospitals, wherein the topics that we are going to cover are: discuss quality of care and inpatient mortality, explain SHRM and organizational performance, describe high-performance HRM systems and patient mortality. Let us understand that similar to other organizations, hospitals are concerned with maximizing effectiveness through the adoption of appropriate management policies and practices. And unlike most other organizations, however, effectiveness, if we talk about in hospitals, can be measured partly by their success in treating illness and avoiding deaths. We cannot say, any hospital or any organization of hospitals, who are dealing in wellness are doing good enough with just good infrastructure or with good people. Rather, they are doing well if they are getting success in avoiding deaths or if they are getting success in treating illness. And that is what differentiates a good hospital organization from the mediocre one. So now the question arises that we just talked about effectiveness, that how we can measure the effectiveness or efficiency of an organization, right? So the question arises, how can we measure the effectiveness, right? So in this unit we will build upon and study more of strategic human resource management to examine that what is the influence of this system on HR policies and practices in any organization's healthcare outcome or patient mortality, or what we were talking about, dealing in patients' death or avoiding deaths and treating the illness of the patients. Now let's talk about quality of care and inpatient mortality in hospitals. What exactly is quality of care or inpatient mortality that we are discussing out here? Quality of care, as mentioned here, is defined as the degree to which health services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current professional knowledge. Right, in the initial sessions we discussed that in hospitals or in organizations like hospitals, it's not important that you have good pool of employees or personnel in good quantities. Rather, what is important is, are you able to provide the quality of care? Because efficiency of a hospital is measured in terms of patient care rather in terms of infrastructure. Although these things are important, they play a major role, but then how the effectiveness or efficiency of an hospital organization is measured is in terms of quality of care. So it is very important for us to understand that what exactly it is, and here it's written that it is the degree to which healthy services for individuals and population increase the likelihood of desired health outcomes. What you are expecting is being given by the organization. Now let's talk about inpatient mortality, that is also known as preventable mortality. So what exactly is preventable mortality? It refers to the avoidable inpatient hospital death, those that are not an expected or probable outcome of a patient's hospital stay. So there is a growing recognition these days that organizational interventions to improve patient care planning, enhanced communications among caregivers, or better assess to patients' risk of death and better respond to signals of deteriorating patient health, and adoption of evidence-based care practices and protocols that can reduce preventable deaths. So these things are becoming more and more important these days, and so arises the need to develop the insight of inpatient or mortality in hospitals. So we can see, that these days inpatient mortality is becoming a big challenge for hospitals to tackle. So why this problem is coming? It may be because of the limited understanding about OB, organizational behavior theories and methodologies. So therefore a very powerful OB paradigm should be adopted for understanding organizational performance, and we should apply this study to control hospitals inpatient mortality. And then only we can focus on the relationship between hospital HRM systems and then patient mortality in hospitals. So this is one way of tackling with inpatient mortality in hospitals. These days, there are many hospitals which are coming up with different programs, to reduce the preventable mortality, and one such approach that was followed gave the program on learning series, which contained local and national expertise on interventions with best practices for reducing hospital mortality rates. Then they also provided the website resources, the via which the patient care link was there, with tools and resources in key content areas. Then virtual networking was one way which will foster inquiries, and wherein the people can share resources and promote learning across hospitals. There was individualized technical assistance, then communications through websites was also given emphasis. So all these things were focused upon to reduce the inpatient mortality in hospitals. Let's see what is the relationship between the hospital HR system and patient mortality in hospitals, and why we should focus on HRM. So there was this person, Donna Bedian, who provided a sophisticated and very well used model of patient care quality, in which he identified two basic aspects of patient care, and one was technical, other was interpersonal. So he said that technical aspects of care refer to the appropriate application of professional knowledge and skills to promote health care, and then there are interpersonal aspects of care which will involve both the relationships between patients and healthcare professionals. So unless until you have good behavioral skills and good technical skills, you cannot reduce this patient mortality in hospitals. And why we should focus on HRM? Because HRM will bring a synchronization among technical skills of an individual and interpersonal skills. Technicals means subjective knowledge or the professional knowledge and skills that you have gained, and then interpersonal is how are you involving your relationships with the patients and healthcare professionals, as well as contextual aspects of care. So human resource policies and practices are likely to influence patient care quality by impacting both technical and interpersonal aspects of quality care. And when we are able to take care of patient care, obviously we will be able to reduce the patient mortality in hospital. So our primary focus should be on the system of HRM practices as opposed to the individual practices and their relationship to the quality of patient care. So high performance HRM systems because can improve healthcare outcomes in hospital settings, because they will promote effective information processing, decision making in environments, and which is very critical. So investments in high performance work system will yield superior health care, and this is how this equation is. You have to invest in HRM, indirectly superior health care, and indirectly the cost will be reduced, because these systems will increase employees' capacity to interpret information on ongoing basis, and they will directly act upon it. And so this will not only increase employees' knowledge and broaden its task responsibility, rather than it will improve the dedication of an employee for their organization, and it indirectly will help into taking care of patient care. And that was all about the relationship between hospital HR system and patient mortality in hospitals. Coming next, we are going to discuss SHRM and organizational performance. SHRM, as written out here, is strategic human resource management, is the practice of aligning business strategy with that of HR practices to achieve the strategic goals of the organization. Now, why does SHRM fit in with the strategy? See, if we try and understand it in our own language and general terms, with the advent of today's economy, where services account for a major share of the GDP, and hospital is also one of the service industry, and the fact that service sector we know is essentially people centric. If you talk about products, like there are FMCG industry, you can see the tangible products, wherein industries like hospital or hotels, wherein you cannot touch and feel the product, rather services are very important out here, how you are being treated. So the practice of SHRM demands a proactive and hands-on approach by the management as well as the HR department with regards to the entire gamut of activities ranging from staffing, training, development to mentoring to pay to performance management. So when all these things are done strategically, we are able to handle SHRM and in a way handle organizational performance. So now the question arises that how SHRM actually works. See, SHRM, if we talk about the real world example, many organizations, in recent times have dedicated people managers whose sole function is to look after the enabling and fulfilling needs of the resources. So this is a marked change from treating people as just resources, rather than now people are being treated as assets. For example, there was this company Infosys, that is said that people are its assets, right? And one of the founders of this company said that the capital of Infosys walks in every morning and walks out every evening. It has to be taken in this context. So one finds that organizations tend to leverage upon the capabilities of the people employed there and ensures that the human capital is nourished and nurtured as a source of competitive advantage. So this is what SHRM has to do. So there were times when management could dictate terms to the employees and tread upon their rights. So this is not anyways practiced these days. So with the coming up of or ballooning up of white collar workforce, it becomes necessary for organization to pay more attention to the needs of employees more than ever. So finally, the fact that organization derive their strategy from employees instead of imposing a strategy upon them is the essence of SHRM. So that was all about SHRM. Now let's see what high performance HRM systems and patient mortality have something in common. So HR policies and practices that we discussed earlier, they impact organizational effectiveness definitely, and that not only influence organizational effectiveness, apart from that they also influence organizational outcomes and financial outcomes. So what are exactly organizational effectiveness? What comes under this organizational effectiveness? Basically, if we talk about organizational effectiveness, that will include human resource outcomes. That is, turnover or absenteeism, how frequently the employees are coming and leaving. That is, if it is happening very frequently, that is not good for any organization. And then absenteeism, if the employees are, taking a lot of leaves, that also is at all not good for the organization. So, we should measure the productivity or the performance of any organization on the basis of organizational effectiveness. Then organizational outcomes. Organizational outcomes will definitely count upon productivity and inpatient mortality. If you are able to avoid deaths and you are able to take care of illness, that means you have a good organizational outcome. Finally, if we are talking about financial outcome, it will definitely talk in tangible or commercial terms. That is, how much of profits are you able to poach in, or what is the market value of your organization. So these things are included in high performance HRM systems. So that was all the impact. Apart from all these things, in industrial settings, SHRM studies have been empirically linked with not only HRM systems that we discussed right now. Also, these things are linked with turnover, then service quality, then firm's profitability and market value. And now, people are proposing to link, this thing that we were discussing, HRM, with inpatient mortality in hospital, and that will count upon the organizational effectiveness and its outcomes. Now, what are those HR practices that affect inpatient mortality in hospitals? See, a number of authors have previously developed approaches to measuring high commitment or high involvement HR system, which we call as high performance HRM systems. So HRM practices affect performance by enhancing employees' skills, knowledge and commitment by providing them with discretion necessary to capitalize on these skills and commitment. So HRM practices, both conceptual and empirical works, tend to focus on HRM practices, and they are all related to performance appraisal, management, training, decentralization, participatory mechanism, team-based structure, then employee security, staffing, and then compensation. So we are including all these 6 of practices in our study of high performance HRM that we just discussed. That what are high performance HRM is basically nothing but they are the tested and developed approaches to measuring high commitment and high involvement of our people. So we will be discussing all such things in length in our next session. For now, that's all, and I have something for you to answer. And the first question that comes out here is, describe high performance HRM and organizational performance. Next, that you have to do it on your own, will be discuss quality of care and inpatient mortality in hospitals. That's all for today. We'll catch you all in the next session. Thank you. Thanks a lot, students.